Now, this is a very interesting topic, that is brain and uh, its different lobes and its functions. Now, it's very important to know the normal anatomy of the brain and the functions of respective lobes. For that, we should understand few things like the lowermost parts. So we can see this is brain which is starting in brain is increasing in the quantity. So this is increase in quantity. So this is medial part, and then brain is again getting reduced in size. So this is uppermost part of the brain. So this is uppermost part of the brain. This is middle part, and this is lower part, because from here we can see that this is nosal part and this is all spinal cord which is getting started. So towards the lower portion of the brain, what we can see is brain stem structure. So brain stem structure consists of uh, medulla oblongata, pons, and midbrain. It is very easy to understand. This the lowermost portion which we can see here is all cerebellum. So cerebellum is the most posterior part, because this is posterior cranial fossa, this is middle cranial fossa, and this is anterior cranial fossa. So the posterior part, the lowest most part of the brainstem is medulla, and this is all medulla. The lowest most part in the centrum, which continues as spinal cord, is medulla. So this is part of medulla. Above medulla, where you can exactly see a rounded structure, we can simply call it as pons. So this is all medullary part. This is pons, and this perfectly circular structure is pons. So this is pons. And above that, a butterfly-shaped structure is midbrain. So this is basically midbrain. So these three things, that is midbrain, pons, and medulla, we call it as brainstem. And this they have intensive connections with cerebellum. You can see the cerebellum is connected here. So basically, this brainstem is the automatic system of the body. Automatic system of the body means these are the structures which actually control the heart rate, which controls the respiratory rate, which controls the blood pressure. So this brainstem is the structure which gives impulses to the heart, which gives impulses to the lungs, diaphragm, and these are the things which actually maintains our vitals, which are heart rate. So the heart rate is kept in between 60 to 90. Whenever we have increased physical activity, it increases the heart rate. Whenever we sleep, the heart rate reduces. All this control is done by these brainstem structures. So this is kind of automatic system. We don't have to pay attention to our heart rate. We don't have to pay attention to the respiratory rate. We don't have to pay attention to the blood pressure, because this brainstem structure, these automatically modulate our impulses so that the heart rate increases whenever we are doing fighting, running, jogging, physical activity. Our blood pressure increase whenever we do increase physical activity, and our blood pressure, respiratory rate, everything increases or decreases as per the need of the body. And this is all modulated by the brainstem structure, which is pons, medulla, and midbrain. So how to identify it is very easy. The circular most portion is the pons. So the lower portion, this is also pons. This is also pons. The above, this is also pons, almost the circular portion, and the butterfly shaped structure is then midbrain. So this is transforming into midbrain, which we can see here. So just posterior to this brainstem is what we have is cerebellum. So this is all cerebellum. Just posterior to this is all cerebellum. Cerebellum is one of the most important thing which does the balance of muscle activities, balance, coordination of movements. This is the most important thing which is done by cerebellum. So whenever we are walking, standing, jogging, running, jumping, each and everything what we do, each and every muscle activity do, while writing, while putting anything, pushing anything, any muscle activity we do, the contraction of one muscle, relaxation of other muscle, this is all the balance and the coordination, like which muscle to contract, which muscle to relax, which muscle to contract, which all the muscles to contract, which all the muscles to relax. This is all divided, is done by cerebellum. Just imagine a footballer or the famous cricketer who is playing very beautifully. They use so much beautiful shots. They use so many muscles of the body. So there we need perfect balance of all these muscles. Then only this is possible. So this balance of muscle activities, coordination of all these muscle activities is done by this cerebellum. So whenever there is uh, uh, this balance issues, then patients can commonly have nystagmus, tremors. So these patients, if they have some lesion in the cerebellum, they may not have any weakness, but they will have definitely difficulty in coordination of the movements. So such patients may have nystagmus because our eye coordination is extremely important. You cannot do a muscle activity like playing or shooting a football without not seeing the ball. You have to see the ball. So eye coordination is also one of the integral part of the cerebellum function. So, and then the cerebellum needs this brainstem, then only the heart rate, blood pressure, respiration can increase. Uh, if you have to run, your heart rate cannot remain 60 because if you are running, your leg muscles, arm muscles, they need so much of energy. So the heart rate must increase to 100, 102, 110. Then only that muscles can be pumped. The blood pressure has to rise. If the blood pressure doesn't rise, then how can your leg muscles get good blood flow? So this brainstem coordinates to the cerebellum extensively at all the time. That is the reason why they are so closely linked. One of the most important thing this brainstem has is reticular activating system. Now, what is this reticular activating system? This reticular activating system means reticulum means with thin threads. So this brainstem has so much of integral this thread-like structure. And what is the role of this? The role of this thread-like structure, which is present between midbrain, pons, and medulla, is awareness. What do you mean by awareness? Awareness means whenever we are sleeping, whenever we are sleeping, if someone calls you, if someone comes to you, someone sees you, someone shakes you, then you realize that something is happening to you. That is what is awareness is. So awareness is about knowing the surrounding stimuli. If someone is dead, no matter what you do, they are not going to respond to you. So if someone has to respond to you, they should have awareness. If the person is not at all aware about anything surrounding the person, then they cannot react at all. So if you are sleeping, if someone calls you, the doc, please come or do this, do that, then whether to respond to them or not, that is your choice. But you have to listen to that, you have to see to that, then only you'll be able to respond to that. So awareness is very important. So very commonly, if this brainstem structure gets damaged, if you get an ischemic stroke here, or if you get bleeding here, the patient may be completely comatose. The patient can be completely comatose. So it's very important to remember that the patient may have uh, problems in awareness. Now, the next thing that we can see is basically the mm, just in the posterior side we can see is the occipital lobe. So this is all posterior area. As we can see, posterior means what? It is backside. So our skull is divided into three portions, that is anterior portion, middle portion, and the posterior portion. So this is posterior portion, this is middle portion, and this is anterior portion. So around the cerebellum, what we have is this occipital lobe. So you can see this is all occipital lobe. Now what is the role of this occipital lobe is, this occipital lobe has role in vision. So this occipital lobe actually stores all the visual cues, like a pen is of this size, or if the ball is of this size, or if the square will be of this shape, or a rectangle will be like this shape. So whenever we see any logo, whenever we see that football, then football will be of this size or shape. Or if you say ki bat, a cricket bat, then you will be having the shape of this. So these all structures, their colors, they all have, basically these all things are stored in this occipital lobe. So whenever we say yellow, so automatically you'll see this color. So this color, shape, sizes, everything is stored into here. So if someone says like a fountain pen, if someone says fountain pen, then automatically your occipital lobes knows ki how the fountain pen looks, how can it may present in different shapes, different sizes. So anything like a mobile, you can see like an iPhone or Samsung or whatever phone you say, automatically your occipital lobe will lighten up, and it will imagine all different shapes, different sizes, different structures of a particular thing. So these visual cues are all stored by the occipital lobe. So if someone gets damage to this occipital lobe, then they will lose this vision. Then that patient will not be able to see a structure. The patient will not be able to see, or their vision can get markedly poor because of the stroke in the occipital lobe. The other things, the other lobes which are there are basically the frontal lobe, which is very, very, very important. We can see then the this is the basically, as I told, this is the posterior fossa, this is the middle fossa you can see here, and this is the anterior cranial fossa. In the anterior cranial fossa, you can very easily see that we have a frontal lobe. So this is all frontal lobe. We can very easily make out here. See, this is the dimple. This is the dimple. You can very easily see, and above this dimple is all frontal lobe. So we can, this posterior to the dimple, this is all temporal lobe. We can see this is temporal fossa. So this is all a temporal lobe, temporal fossa, and in front of that is all frontal lobe. So just in front of this dimple, or what we call it a central sulcus, because it is present in the center of the brain. So you can see this is the center, and there is the central sulcus. So in front of this is all frontal lobe. See here, see here, see here, here. So in front of this is all frontal, and this all area is temporal lobe. So this frontal lobe is basically one of the most important lobe, which is involved in all the higher mental functions like abstract thinking, judgment, problem solving, calculation. All these things are present in basically this frontal lobe. So all the criminals, they have very bad frontal lobes. All the best persons, they have very good frontal lobe. So for example, Einstein has a very good frontal functioning, or Oppenheimer will have a very good frontal lobe functioning, because they frontal lobe is extensively involved in judgment, in abstract thinking, in problem solving, in calculation, in limbic system, or in higher thought processes like humanity, love, lust, anger. All these limbic system things, or all these higher mental powers of the brain, are actually decoded or stored or processed in the frontal lobe. So those people who have very good frontal lobes, they basically have very good functioning of this. And those patients who have very bad frontal lobe functioning, they will turn themselves into criminals. So this is very, very, very commonly seen. So we are seeing this frontal lobe, then the cerebellum, then the brainstem, then the occipital lobe. Now we'll see the other structure, which is parietal lobe. So the uppermost portion of this brain is usually all the parietal lobe, and the lateral portion means this one is all frontal lobe. The posterior will be the occipital lobe. The just backside of this frontal lobe will be temporal lobe, which we can see in temporal fossa. And above this temporal fossa, what we see is all this parietal lobe. So here we can see it's very easy. We can see this, the notch is there. This notch completely disappears here. So here the notch is there. Now this notch has disappeared. Now here what we have is all parietal lobe. So in this parietal lobe, what we see is the color vision. What we see is all enjoyment function. So uh, color vision, enjoying life, these are all functions of parietal lobe. Also, parietal lobe has all the functions of sensory uh, sensory inputs. It means whatever sensations that are coming from our arm, legs, skin, that can be pain, that can be temperature, that can be pressure, these all sensations actually come to the parietal lobe. So, understanding these pain, temperature, vibration senses, they all come to the parietal lobe. Also, both frontal lobe and parietal lobe, they are involved in motor activities. Motor activities means the frontal lobe actually gives rise to all the neurons which goes to all the muscles of the body, and whenever they command, that time the patient or the person get contraction. So if you want to move the arm, if you want to move the leg, then the frontal lobe should give a nod that yes, contract it, then only we can be able to contract. So parietal lobe basically takes data from all the muscles from the skin about the current temperature, vibration, pressure, or whatever the situations we are in. So our parietal lobe knows ki what is the position of my current leg, what is the position of right leg, what is the position of left leg, how much my knee is bent, how much my hip is bent, how much my ankle is bent, what is the position, what is the pressure. This all is known by parietal lobe. So if someone is playing table tennis, cricket, full football, then we have to know what is the actual position of our legs, muscles, arm, everything. This data is again goes to the frontal lobe that this is the position of my joints, this is the position of my muscles, this is the like 10-degree contraction, 20-degree contraction, or 10-degree bend, 30-degree bend. And as per that, frontal lobe then gives the message that all these muscles contract, all these muscles relax. And that is how these impulses go to respective muscles and then contraction occurs. So, if anyone has to do motor activity like walking, running, gymming, playing, jumping, whatever you want to do, all these muscles which contract, for that the parietal lobe is responsible for understanding the position of joints, position of the muscles, position of tendons, and actually it is the frontal lobe which gives command that go and contract, bicep muscle contract, quadricep muscle relax, brachioradialis contract, this muscle tricep relax. So every all these messages are given by frontal lobe, and for that parietal lobe impulses or knowledge is very important. So frontal and parietal, they together are one of the most important thing for contraction of the muscles. Other things which are very very important is when we see here, we can very nicely make out that this is the caudate lobe. If you can see here, just see here, you can very nicely make out this is caudate. uh, this is a part of basal ganglia, and you can see very easily. I'll uh, clean this up. So you can see that this is the caudate lobe. You can see here, this is the caudate lobe. This is the basal ganglia portion. So this is lens shaped structure. Lens means triangle. So this is lens shaped structure. If you can see, you can see here also. This is all a large almond-like structure. So this is thalamus. The large structure is thalamus. This is caudate lobe, and this is putamen and globus pallidus. So this putamen, globus pallidus, and caudate lobe, this is called basal ganglia. Now, this basal ganglia, basically, they are involved in muscle contraction, motor movements. So, if you want to play a straight drive, if you want to play a flicker, or if you want to ball a bouncer, or if you want to kick, or if you want to play a table tennis shot, or if you want to hold a mobile, if you want to hold a pen, anything, if you want to hold a glass, if you want to eat, all these are the movement, muscular movement activities. For this, our brain must have some software for that, some memory for that. That whenever you want to hold a glass, which muscle will contract how much, which what will be the position of arm, what will be the position of forearm, which muscles will contract, which muscle will use how much power. Everything is a program, and this program is stored in this basal ganglia. So these two things, they store this program. For so if you have a very thin glass in your hand, and if someone asks you to hold that glass, you cannot give so much pressure, because if it ruptures, if it gets ruptured, then your hand will get injured, your arm will get bleeding. So you have to hold, you have to press that glass with very cautious pressure. So you, how much pressure we should use, what should be the angle, what should be the position of hand, what should be the position of arm, what should be the position of forearm, everything is a program, and this program is stored in the basal ganglia. So this basal ganglia, so the parietal lobe knows ki what is the position of my forearm, what is the position of my arm, what is the pressure in my bicep muscle, what is the pressure in my tricep muscle, what is the pressure in my brachiodalis muscle, what is the pressure in my hand muscles. This is known by parietal lobe. Now, how to hold a glass? This program, this basal ganglia know. But for this, the frontal lobe should give command that this bicep go and contract, this go and contract, now contract, 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 these muscles relax, tricep relax. So this message is given by frontal. Parietal gives sensory inputs, and this basal ganglia stores the program for all this contraction. So whenever you have this basal ganglia damage, like in ischemic stroke or in bleed, the patients get hemiparesis or weakness of that particular arm. And this is the thalamus. This thalamus is placed in the most center, because almost all the sensations come to the thalamus. Thalamus basically receives all the sensory inputs, all the motor inputs. So basically thalamus is the relay center for all. It almost connects everything. It almost connects to each and every lobe, even to the brainstem, cerebellum, everything. So thalamus is the structure which connects the whole brain, which actually coordinates everything. So if thalamus has a role in awareness. Thalamus has the role in coordination of movement. It has role in motor movements. It has role in higher mental functional movements. It has role in vision. So it has role in everything, because thalamus is the relay center of all the sensation. So in thalamus receives impulses from all the brain, including brainstem, cerebellum, frontal lobe, parietal lobe, and this basal ganglia as well. So for you, I'll just simply draw this thing again, because it is very nicely seen. Just focus in this area. You can see this, the blackish structure is caudate. This lens triangle like shape is the basal ganglia portion, which has putamen outside and has globus pallidus inside. And this area, which is large almond shaped structure, is thalamus. So in between the two, if you can very nicely make out here, this is the structure, this is the structure. So this all portion is called internal capsule. So internal capsule is the all fibers which are coming from the frontal lobe, parietal lobe, which is densely packed with all the neurons. It is densely packed. So if someone gets even a small infarct of 1 to 2 millimeter also, the patient may get dense weakness of both upper limb as well as lower limb. So this was overall about few of the structures. We'll again come with the next topic. Thank you.